here at the 2010 OneMedForum, and right now I'm joined by Amar Sawhney with Ocular Therapeutix. Thank you, Amar, for being with us.
Thank you. It's my pleasure.
Tell me a little bit about your company.
Well, Ocular Therapeutix is about 3 years old. The technology actually has a history that goes beyond that. It was originally the basis of a few other companies, some of which are presenting at the JP Morgan conference, like Access Closure, my previous company, Confluent Surgical, which was acquired by Covidian. So technology basically consists of a liquid hydrogel precursor. These liquids, when they're applied onto tissue, they actually do chemistry inside the body and transform into solids. And those solids can persist locally and do various things. They can act as sealants, as local bandages, they can prevent leaks, they can prevent scar, and deliver local drugs. So using that technology in various areas, now Ocular Therapeutix is focused on the ophthalmology segment. So that's our focus, and we're getting pretty far along in the development process.
So tell me more about the application in ophthalmology.
In ophthalmology, we are targeting ocular incisions. So we're developing a bandage, a liquid bandage, that can be applied on any ocular incisions. If you think about it, when we do surgery, we have a topical wound on the skin and other places. We apply a bandage. But a sensitive organ like the eye, we don't apply any bandage, and we leave it open to potential infections, discomfort, etc. So the reason we don't do that is because developing and designing a bandage for the eye is very tough. It has to be a very compatible material that the patient doesn't feel, doesn't create any irritation, safely resorbs, and is very comfortable and yet functions as a watertight barrier. All these things are incorporated into the product iZip, which we are developing as an ocular bandage. So that's our first product. And I think we have finished off our development process, we've finished off our clinical trials. Product has just been commercially launched in Europe, and we are gearing up to do a launch in the US hopefully soon.
Great, what else is coming down the pipeline for Ocular?
In ocular, what we are then looking at is drug delivery. If you think about it, drops have been used in the eyes as the normal way of delivering drugs to the eye. But what people don't know is that 97% of a drop actually gets flushed down the tear ducts and doesn't end up inside the eye. We are developing little reservoirs that would release that drug over a longer period of time. So for example, antibiotics over a week to 10 days. And these would be placed in tiny little ducts that are there, which clear the tears. These are called punctums. There are 2 of them in each eye. So these will be very tiny, sub 1 millimeter type of implants that are placed for 7 to 10 days. They deliver antibiotics over 2 weeks and then safely resorb. So you wouldn't have to take eye drops, for example, after surgery for antibiotics. This technology can be applied for a whole range of other ophthalmic drugs, for example, glaucoma medication, dry eye medication, etc. And we are developing those types of products for the future, so the prospect of many, many products down the pipeline is there for Ocular.
Great. Are there any other specific events or news that is going to come out regarding Ocular in the new year?
Sure. We have just started our commercial launch in Europe, so that's just coming out now. And we hope to gain our US approval over the next few months. So that'll be the big news for the year. And hopefully early next year sometime we can head towards profitability.
Great, and you're presenting here at the conference really soon, right after you leave this conversation. So what are you hoping to gain from your presentation?
I think part of it right now is awareness building. We did our Series C round of financing last year around this time. So we do have cash in the bank, and there's a lot of interest from the investors. But part of it is awareness building. We had a distinguished panel of several of our friends who are in the ophthalmology segment out here, and when I saw the names, I said, why not come by and meet them?
Great. Well, thank you for speaking with me, Amar. It was nice to meet you, and good luck in the future.
Thank you so much, Alyssa. Bye-bye.